I am presenting now a fibromyalgia case. This patient presented to us when she was 40 years old, female. She is Middle Eastern in origin. She came with the chief complaint of I always have pain in my neck, shoulders, my face, and also my bite is open. And her history has been going on for the past 5 years or more. Her pain is mostly in the jaws. She feels that it's continuous, but it's not noticed except when she presses on the jaw or the neck or shoulder muscles. It's also affecting her hands. She feels that the pain comes down all the way to her hands, and when she presses, it feels really, really painful. Or also when she opens her mouth. And as I said, it's been going on for a long time. She is living with this pain. She doesn't feel it sometimes, but it's overwhelming for her at multi levels. And also, she mentioned that she feels sometimes pain coming down to her legs, but she's not able to correlate what's the relationship between her upper pain and lower pain. Her pain is 8 out of 10 on the VAS scale and is affecting the whole well being as she always feels very tired and yawning. She feels better after a massage and she feels worse after concentrating for work. And she said, in her own words, when I finish, I feel dead. And associated symptoms are sleepiness, yawning, and insomnia. In terms of sleep history, she says that I do not recall when was the last night I slept well. Her sleep pattern is very interrupted. She has very shallow sleep. She snores when she sleeps. She wakes up multiple times, at least 4 times, and she doesn't feel that she gasps for air, but when she wakes up, she feels very tired. Past medical history, patient had a sinus and adenoid surgery to be cleaned, in her own words. This is what she said. Probably they were inflamed or infected and they needed to be cleaned. This was back in 2002 and because it was affecting her breathing. 9 months ago, she was diagnosed with fibromyalgia by a neurologist because she was feeling pain all over her body. Accordingly, she started to introduce some healthy lifestyles, and also she has a history of recurrent yeast infection in the vagina, and she feels that she loses her breath when she climbs stairs or she walks a little bit, and she is chronically a mouth breather. In terms of medications, she only takes probiotics, magnesium, and duflacan, which is the anti-yeast for the candida. She's allergic to dust and perfume, and also the smell of cigarettes as well. In terms of family history, they have a sleep apnea history. Her brother and sister, both of them have sleep apnea due to overweight. And also, many people in her family, and even 2 of her kids, she said they have asthma, and her mother has high blood pressure. Social history, the patient has depression, history of depression, and also until now she feels anxiety, she feels overwhelmed, she has many problems with her marriage, she's not sure if she wants to stay or leave. She's the only one who supports the family financially with 3 kids, and she drinks alcohol 2 days a week. In terms of habits, she feels that she always have to catch up her breath, meaning she has to stop even while she's speaking to kind of take a deep breath because she feels she loses her breath. And this is annoying her because people feel that she is annoyed when she stops and do that. Like they think she's not interested in what they say. In general, she said, I am not a disciplined person, and she is working to improve that. Extraoral examination showed severe tenderness in all masticatory and neck muscles. Masseter, temporalis, sternocleidomastoid, and trapezius, everything was severely tender. She has mild condylar pain, though. Her Opening, it's within the normal range, whether for active or passive. She is kind of within the normal range, and also similar to the lateral excursion. She's kind of on the lower end, but it is acceptable. She occasionally has a click on both sides. Intraorally, the patient has major wear facets on her molars. History of that goes back to one dentist who did occlusal adjustment for her teeth years ago to solve the jaw and bite issue. I'm not sure why he did that. Was it to reduce the open bite anteriorly, or was it because she had restorations? I am not sure, but she has a more or less flat occlusal plane. She also has a history of braces back in between 1994 and 1996, and she had 4 molars were extracted because her teeth were protruding. And as we can see here, this is her intraoral pictures. We appreciate more the narrow maxilla, the open bite anteriorly, and mild crowding in the upper and lower. And we can see all her molars are flat, and all of them are restored as well. She has a history of a retainer after braces, but 3 years ago, one doctor suggested that she should always wear a night guard because she clenches her teeth, and she does believe that she does clench her teeth mainly when she is focusing or concentrating for work. She feels that she clenches her teeth to the point where her jaw feels locked. This is the panoramic radiograph. We can see normal condyles. We see also third molars, upper and lower, are erupted and in occlusion, but we do appreciate even on the pano the flat cusp tips and palatal, the cusp tips, I mean the occlusal plane of the teeth. Cephalometric X-ray shows the vertical increase in the vertical dimension, the open bite, the narrow airways, as well as we can see in the back here, which explains very well her problem with breathing and her problem with the quality of sleep as well. And also the family history of sleep apnea makes all of this is a red flag for us for this breathing issue. Accordingly, my diagnosis would be myofascial pain of the masticatory and neck muscles, of course, because of all the tenderness she has. She has a malocclusion of open bite. She has internal derangement of clicking bilateral. She has bruxism and daytime clenching. She has fibromyalgia based on that neurologist diagnosis. She has a history of insomnia also, and anxiety, and possible sleep apnea, which will need further investigation. So the plan was first to start with patient education at multi-level. First of all, about the fibromyalgia, I told her that usually fibromyalgia is controlled with medications, but seems that her diagnosis wasn't 100%. In my opinion, when I talked to her, it didn't feel like it was diagnosed properly according to the criteria. It felt like the neurologist went with the overall feel of pain everywhere in the body, and that gave him the clue of fibromyalgia. So I feel that she needs to investigate this better before we really put her on the road of medications. So I educated her about that, but in general, she is someone who doesn't like to take medications and rather want to find alternative ways to solve her problem. Also, I educated her about her malocclusion, the open bite, and that is contributing to also the problem and the wear of the teeth, mainly that she's clencher, and due to the verticality, she needs to know that in order to correct the open bite, we might need to do orthognathic surgery with Lefort 1 maxillary impaction. Also, I educated her about the sleep apnea risk. She has many red flags in her history, whether it is her brother and sister, and whether her sleep pattern, and she wakes up very tired, she's always sleepy and always yawning, All these are red flags for sleep apnea. So I also educated her about that and said that we can refer you for sleep study to really have a proper diagnosis for the AHI index and see if she really has sleep apnea. In terms of insomnia, I educated her about the sleep hygiene and how to reduce anxiety and stress with breathing and all of that. And I gave her referrals to the maxillofacial surgeon to assess her open bite and for the orthopedic to assess her neck pain because she has severe neck pain and to rule out any nerve impingement, mainly that she said the pain goes down to her hands. Also, I referred her to the ENT to assess her breathing because she still feels blocked and her surgery was long time ago. And again, if she wants, we can refer her to the psychologist for the anxiety and the maybe I recommended CBT to help her to reduce her anxiety and deal with her psychological problems. So, in terms of the myofascial pain, I educated her about the posture, whether for the head, neck, or tongue during work and after that, and how to do the stretches. I educated her about the myofascial protocol of avoidance and heat and the exercises and the all the protocol we usually follow for myofascial pain. And then I suggested for her that we can do a splint in order to reduce the load on her, to protect her teeth first from more wear and also to reduce the load on the muscles and joint. Also give her the option of NSAIDs for 2 weeks to also reduce the inflammation and the possibility of trigger point injections in case of trigger points that we found in the masseter and temporalis. The patient in follow-up, she saw the maxillofacial surgeon, but he explained all the procedure and he agrees that she does need maxillary impaction and mandibular rotation, but she cannot afford the high cost, as well as she declined anything related to high cost treatments or investigations or even to take any medications. She said she wants to do the minimum with the least expense and with the least medication. So she wanted to start with the splint and the myofascial protocol. And this is what we did. We gave her a splint, and as you can see, because she has open bite, this necessitates the anterior part to be very thick in comparison to a very thin posterior part in order to keep a stabilizing splint that covers and touches all the teeth. And then when the patient came back after 2 weeks, she said that her pain levels went down from 4 to 10. She now sleeps better, but she still wakes up a little less than before, but she goes back to sleep faster. And now she is focusing on aerobic exercises, which she felt it has helped a lot with her fibromyalgia. In review of the literature, I found 2 studies. One of them didn't find a very strong evidence to support that aerobic exercise help with the fibromyalgia patient. This was a study that compared individuals who were doing aerobic exercise versus controls with a non-exercise interventions like medications or education. So the quality of the evidence was low to support that exercises help in fibromyalgia. But another study actually was supportive. It was a meta-analysis that looked at the effect of exercise on anxiety in fibromyalgia. It found that it did help the anxiety level to reduce in fibromyalgia patients. So I recently was able to contact the patient. She has left actually the country around a year ago, but recently I was able to be in touch with her, and she said that she got a divorce and now she feels she's more clear about her emotions and more settled She got a new career path that she always wanted to proceed with, and she's very happy and passionate about it. She exercises now regularly, and accordingly, she feels much better. She has lost her splint and she couldn't get a replacement, but she feels that her pain in the face has reduced tremendously and is not coming back. But the only thing she is concerned about and still bothering her is the shoulder and neck pain, mainly that all her work needs more sitting on the computer, and probably that puts a lot of pressure on the neck and shoulder muscles. But overall, she's doing well, and I'm not sure though about really when I looked back at this case. I don't believe she was properly diagnosed as fibromyalgia, uh, because first she is her diagnosis wasn't definitive in the logical way of diagnosing, in the systematic way. And also, it's good thing that she's improving with small efforts like aerobics and things like that. And that's all. Thank you very much.